Welcome to Happily Family. I'm Cecilia Hilkey.
And I'm Jason Hilkey.
And we're delighted today to have Dr. Joseph Lee with us. Joey is a psychiatrist in Southern California. Early in his practice, he saw that his patients were clearly getting better, but didn't seem to be quite well. His search to help people truly thrive led him to help others develop self-worth, meaningful relationships, and lifelong optimal healthiness. Welcome, Joey. It's great to have you.
Hey, Joey. Good to see you again.
Good to be back. Hi, guys.
It's always good talking to you. You always blow my mind when we talk, not to set you up or anything here, but like I just so love talking to you because you just bring things down to earth and we're able to talk about things in a way that's so relatable. Every time we've interviewed you, every time we've talked to you. So thanks for taking the time. Appreciate it.
Yeah.
And I wanted to start off our conversation because you sent me an article that's kind of been making the rounds from The Guardian, which is, I think, a British publication. And it talked about how we should be looking at mental health in a different way in the US and in other countries than we are right now. So can you explain what that different way is to look at mental health?
So I think, first of all, when we talk about mental health from, let's say, even the larger conversation, even that phrase mental health, when we talk about mental health, is probably more often used as a euphemistic way to talk about what we're really saying is mental illness, depression, anxiety, things like that, right? So first of all, the conversation we're having about is about, mental struggles, really, right? Not actual mental health, right? Well-being. So that's one. So that's one of the lenses that we talk about mental health. The other one is that historically, let's say the treatment of mental health comes from a medical model, and so medical model meaning comes from when things are bad, when things are going wrong, both from a physical health standpoint, but also from therefore a mental health standpoint. So that initial sort of assessment looks at problems and looks at problems that an individual is experiencing, right? So it's also got a very individualistic, personal sort of lens. And because it also comes from a medical model, then we look at symptoms, we look at, from that perspective. And then when we look at treatment, we think about treatment as being resolving symptoms, but not necessarily always root cause. Okay, so those are all sort of the lenses and biases that are pretty normal when we're thinking about mental health / mental illness. So what gets lost when we kind of take all those default assumptions is that we don't really often think about what is the root cause, what is the vulnerability, why is it that this person ends up with a depression or abnormal anxiety, an eating disorder, substance abuse, whatever these, categories that we definitely treat in the context of psychiatry, let's say. But we don't really sort of have where does this all begin and what can we do to address, the vulnerabilities. And also that individualistic kind of lens of like the individual suffering, which is true, like people are individually suffering, doesn't kind of ask the question of like in a relational context, what are the vulnerabilities or potentially even sometimes the assets or strengths that people are underutilizing in the context of, let's say, the relationships, or the people that they share life with, whether those people are a resource to help or, those relationships are the root cause as to why people have experienced abuse, trauma, hardship, neglect, which are all known vulnerabilities for a lot of things like depression, let's say, right? So I think that's kind of, that article is addressing that. I think it's not necessarily a brand new idea, but I do think that overall, people, when we talk about health, when we talk about well-being, people are coming around to acknowledging like we are not speaking enough about sort of like the larger picture as to why, there's seemingly more and more issues with people's mental health.
Yeah. So in general, not just looking at mental health as being this individual thing, but looking at it more collectively, like what are the causes in our culture, in our country, that are leading people, teens, kids, to have struggles in these areas, to
Right.
actually like really get at some of those larger root causes. That's what I hear you saying.
Yes. Yeah, exactly. Right.
Can I read a quote from the article?
Yes.
So what it talked about, it says, we are living in a traumatized and uncertain world. The climate is breaking down. We're trying to stay on top of rising living costs, still weighted with grief, contagion, and isolation, while revelations about the police murdering people shatter our faith in those who are supposed to protect us. So, so yeah, it was just talking about like how these, it's a lot harder to have mental wellness, mental healthiness, in true mental health in these environments where there's a lot of uncertainty.
Yeah, especially because we were talking just I think yesterday about how our kids are growing up in a different world. Like, they're
Right.
I mean, yeah, obviously it's a different world, but I think like having that underlying additional stressors of the uncertainty of the world and some of the trauma that they're seeing and hearing about, and we hear about easily through online media that, we hear it worldwide. It's much easier to hear it now than when we were growing up. That's having an underlying effect on our kids.
Right. Right. Because I think, if they, let's say, are articulating some perspective that says, I don't know what I'm doing all this for, right? Let's say, working hard in school, which has gotten harder in terms of like getting to where you want to get to. The work, has kind of like changed in terms of our understanding what work ought to be and in career. But they're also then sort of correctly saying, and who knows about like what's going to happen relative to climate change, and will I ever be able to, have a family? Do I even want to bring kids into this world? Like there's just like they're not incorrect to almost be asking these questions, about the future that they're going to sort of live into. And yeah, and I don't know, I can't remember that I even remotely had these sort of like existential questions when I was like, in high school, right? Like I just didn't. And so we are definitely living in a different world in terms of the world itself is different, but we're also, in this sort of like post-internet age, the ability to access like information, about things is a lot more accessible, right? But then, we're also now burdened with like, okay, what do we do with all this like easily accessible knowledge too? And without the tools, without the perspective, without mentorship, without experts that we trust, we're kind of like, again, left to ourselves to decide and figure things out. And if you're a kid, like, you just have that normal, I don't know what I don't know, and I've only lived so much life, and I can only draw so many conclusions based on what I've been exposed to. Like the normal ignorance of not yet having lived too many years and still trying to like answer these questions that are huge and weighty, right? So yeah, that's a real thing, right? That's a real thing. If they're inquisitive, curious, open-minded kids, those are not like weird conclusions or weird things to be thinking about. They're almost like the logical progression of the things that I'm learning,
Yeah.
So then I guess
setting, right?
Right. Well, that's kind of, in a way, that's kind of what's been bugging me a bit, is how to support my kids as they're entering into that world, that they're thinking more about. They're looking at these bigger pictures. And, obviously by myself, I'm not going to change, some of these bigger world issues, but what can we be doing? Like, what is it that we can do either on an individual level or on a community or on a social or cultural level to be affecting the kids as they're growing and dealing with these mental health, mental illness problems?
Well, there's actually two areas that I like to kind of talk about that are research based, that kind of really flesh out this idea that mental health is absolutely affected by like certain experiences in life. So one body of research, which you've probably heard about, because I think people have been acknowledging and talking about this recently, which is ACEs, right? Adverse childhood experiences. And so ACEs research is a academic way of acknowledging and following sort of the course of a lifetime, that basically early life childhood experiences that are harmful. And they're basically in categories of like actual abuse, neglect, or a category of what I call like chaos or instability. So if a kid has experienced any of those growing up, abuse, neglect, chaos, there is like a proportional sort of risk based on how many sort of different categories of exposure of adverse childhood experiences that they've had to long-term well-being in terms of their risk for substance abuse, their mental health, their physical health, their eventual educational, occupational attainment, right? So this is a body of research that very much connects like these early childhood experiences and then future risk for physical, emotional, occupational, relational, substance abuse, like all these problems, right? So in that sense, we can firmly say now, right, not in just like a psychodynamic, pop culture kind of way, like, oh, bad things that happen to your childhood, affect you into your adulthood. True, but even in a much more specific, concrete way. So ACEs research kind of tells us, what are the kinds of risks, right? Which then gives us some guidance to say, well, let's not do that to kids. Okay, so that's one. And then another body of research is this area called expressed emotion. So abbreviated EE, poorly named, because what expressed emotion research really means is if you have a high EE environment, what that means is that the primary people in your life that are sort of part of your support system relative to your psychiatric mental health issue, okay? If they see you as a burden, if they express to you excessive criticism, right? That would be considered a high expressed emotion environment, okay? A low expressed emotion, a low EE environment would mean that those primary people in your life, despite the fact that you might carry a certain psychiatric diagnosis, that their interactions with you are particularly warm, accepting, validating of you as a person, despite you having some issues, with your mental health. That would be a low EE environment. And there's research that shows with every single major diagnosis, depression, schizophrenia, bipolar disorder, eating disorder, substance abuse, ADHD, like every single major diagnosis that we see in psychiatry, high EE leads to bad lifelong outcomes. Low EE leads to better lifelong outcomes, right? So on another level, we can say like, look, these relationships that you have, actually have a huge impact on whether or not, you might have an eating disorder that ultimately you overcome with the support of your family, and for the rest of your life maybe it becomes a non-issue, versus something that you struggle with over and over again and have maybe even the worst possible outcomes if that family or social support structure is critical and sees you as a burden, makes you feel that way. So those are like, in some ways those are maybe really intuitive ideas, just to kind of say like, how if you're treated as a diagnosis versus if you're treated as a person, that might like affect how it goes for you. But I'm also saying that like research has a way of teasing that out and saying this is absolutely true, that the relationships in your life and how you are treated and how you are seen and how you are cared for, or versus neglected, criticized, whatever it may be, actually makes a huge outcome in your lifelong mental health. So
Oh.
So I think, that guides us towards these ideas that like, look, relationships matter, environment matters, resources matter, help matters, like in a huge way. And these are for people who, let's say, have identical diagnoses, right? But all these other factors would change your lifelong course as to like well-being, healthiness, quality of life, things like that.
So Joey, this is fascinating. I haven't heard about the expressed emotion research yet. So you know me, I love to geek out about the research. So I'm imagining that there are parents like me in the audience, and they're thinking, okay, this is great. But my kid is really a challenge sometimes. And uh they've and I'm supposed to act like it's not a burden to have them in my life, like love them, think the world of them and everything. But are you suggesting that we hide our emotional experience, or to what extent do we hide our emotional experience from our kids?
I think in particular, it's the sort of like critical sort of interaction, or like the conflation of whatever family problems might exist that could really have nothing to do with that person. It could be the parent or another sibling or whatever, but then to kind of like lump it all together. Oh, it's because you have bipolar disorder, or things like that. So in relation to this, for example, they did a pretty extensive study where with families where I think it was a teenager with bipolar disorder, they separated them into two tracks, and the family had to participate in the treatment. But one version of the family participation was a family education, right? So they taught the family about so-and-so's bipolar disorder. They came on a regular basis, so it was a learning educational experience. So that's the control group. The intervention group, they did a very specific kind of therapy called family-focused therapy, which was a family therapy, which had to do with teaching communication skills, understanding interpersonal dynamics, and it was not built around like, we're here in family therapy because you're the problem, but like we all need to communicate better. We all could do better in these areas. We can be more about like so that intervention, right? So those families participated in this sort of like year-long family-focused therapy instead of just being educated, right? Which maybe indirectly reinforces like the identified patient, right? So they did this intervention. Which again focus on communication, equal dynamics within the family as opposed to establishing hierarchies or whatever. And based on that intervention, they followed people, then the outcome for the individual's bipolar disorder, number of episodes, medication compliance, how many times they went to the hospital, how many crises or emergency room visits, like it all decreased with the family focus,
Wow.
right? So I bring that up because there's some specifics as to like what the intervention was that helped these families go from their default into this like skills-based communication, mindfulness, awareness of, how we're interacting and what language we choose, so it was that change, right? So it's less about like, that's why I say like the expressed emotion description it's a bad description, it's like ADHD is also a bad description of what it actually is. So express emotion is a bad description of what that is, because at the heart of it, it's express emotion. High E is highly critical, really, versus low EE is highly loving, like in actuality, that's what we're talking about, right? So, but that would be an example of like a difference, right, in terms of how families could interact differently, do better,
And so that, as we were talking about, especially the EE piece of it, what I saw in that is hope for families who have kids with mental health illness issues, being able to say like, hey, I can create an environment where they have strong positive likelihood of outcomes of resolving or dealing with their mental health in a way that's going to be supportive of in their long-term life. Like, I don't know about short-term, but at least long-term, that's what I'm hearing is like, this sets them up, because I think that sometimes parents can feel pretty powerless when it comes to their kids' mental health. Sometimes like, what can I do? Like, I just don't know what to do. And that's what they have. And so how do I deal like this? And what I'm hearing in this is hope and an actual, what a family can do.
Right.
to be able to create positive long-term outcomes.
And not just that, it's not like you're asking parents to become mental health experts. You're asking parents to be like more loving, more caring, more in tune, communicate better, like normal parent things. And to know that those, like, if I improve or grow or continue to do all these things that I already do for my kid, I already know then I'm helping them in these lifelong sort of meaningful ways in terms of their lifelong arc dealing with, maybe this particular condition or something like that, right? So it's not asking like a parent to become a psychiatrist or a parent to become a therapist. It's asking a parent to be like, maybe all these other things that we've been talking about for years as to what it is to be like, to do gentle parenting or to do nonviolent communication, or like all these other tools that are related to just generally being a more relationally attached, relationally present, well communicating, loving, caring parent, is actually a therapeutic mental health intervention appropriate for families, right? That they don't have to like do this other sort of, like highly skilled clinical thing. So even more so, like as an encouragement, right? Like I think that makes sense. And I think also with that idea, because oftentimes when you cite research, people are like, oh, how do I find a family focused therapist and then, to do this one intervention? And to be accurate, like I don't think a lot of these interventions really exist outside of research oftentimes, but the research points us to the principles as to like, what's the difference between when they did do this research and the intervention versus what they didn't do, right? And so I think, doesn't necessarily even mean that you have to like go find this one particular treatment modality in order to get the benefit, because I think, again, the research just oftentimes points us to like where in a normal everyday way we can do better and it will matter, right?
Or even just how we interact with a therapist that that our kid is seeing, that we're also a part of that, and that we want that therapist to be involving us as a family in that process.
Yeah.
That sort of like, if I have that framework in mind, then just looking for that in that daily practice, or that not daily, but in that regular practice of meeting with a therapist. And I honestly, I'll have to say, like what we're talking about here is, yeah, we're just asking for parents to do that parenting stuff that we've been talking about for a long time, right?
Right. Yeah.
And
look back at all the other Happily Family conferences we've been talking about for a long time. Those skills, all that, yes, all that, right?
And at the same time, we're talking about doing that with some possibly really big challenges, with kids who maybe it's much more challenging to be doing that with kids who have those mental illnesses or mental health challenges that, like a kid who doesn't have that. It's much easier to do those parenting things with, to be a parent like that. But to be a parent like that in those situations, we kind of have to double down on it. Like that's the thing to go back to. And I think it's just a good reminder of like, we don't need to go do something special. We just go back to the roots, go back to the stuff that we've learned, that we all know how to do about parenting. Just do that. And just as hard as it is, maybe in that situation, like do more of that. That's what I'm hearing. And I just sort of recognize like that could be especially challenging given some of the things that kids deal with that have mental illness.
Yeah. And I think just something you said also reminded me, because, you mentioned like, being involved with, let's say, your kids' therapy. It goes back to one of my earlier points, which is like the way that mental health care is delivered in this medical model is highly individualistic, right? So that in itself makes it almost feel weird with this idea that somehow a mental health intervention involves like something that goes beyond like one-on-one therapy or one-on-one treatment, right? And so that in itself, in a very subconscious way, is one of these barriers when we've framed, mental health interventions as this like one-on-one, intervention from one individual to another individual, therapist, psychiatrist to patient, or whatever that may be. That we're also saying that both on both sides of it, in a preventative sense, but also even if a person's in the middle of it, all these other interventions, involvement, relational interactions, resources, help outside of even the one part of treatment, which might be the therapist, right? Let's say, but all these other things are very much contributing to like big picture well-being, big picture recovery, big picture, long-term course of illness or whatever we're talking about. Like all those things really matter. So we need to always be looking at like beyond the how's it going with the therapist, how's it going with the medication, with the psychiatrist or whatever, that all these other things actually have a critical and very valuable aspect in terms of like big picture outcomes.
Yeah. And I think this is a really important shift too for parents. And I can speak from my own experience too. It's sometimes easy for me to like look at my kid and think the problem is there. And it's harder to look at myself and our family as a unit and be like, okay, in what ways are we all contributing? In what ways am I contributing? And boy, that's hard work. So, and you said earlier, Jason, like going back to what we already know how to do, because there's going to be some people here listening to this that are going to be like, but I don't know how to do that already. Like I mess up at that like 40 times a day. So for that person that's like, this is a big shift, or I don't know how to do this, what would be some baby steps for them to just start? What would you say, Joey?
I think, there's probably a skill in just the communication, right? Of trying not to critique or criticize or blame. And I think oftentimes that I don't think it's actually accurate to really say that somebody like brings upon certain kinds of suffering to themselves, But two, I think with that kind of language, then you kind of inadvertently create that adversarial us versus you, my perspective versus your perspective. It's one of us is right, one of us is wrong. So I think that's almost always like a starting point, which is like how we frame things. And so I think people can learn to kind of, the language of being less judgmental, being more observational, stuff. I think you and I, all of us have familiarized ourselves with, like that model of nonviolent communication gets at the heart of making an observation, because everyone has these like universal needs. And so regardless of the outside behavior and the outside, what you observe, at the heart of it is something highly relatable in terms of, why a person is, suffering. And oftentimes that suffering is because certain needs are not being met and they don't know how, and they didn't bring it upon themselves. Which again reinforces this larger, ability to be non-judgmental. If we recognize, that even bigger picture, that oftentimes, if not most of the time, human suffering happens not because people make mistakes or they have character defects. Most human suffering comes from environmental circumstances, not having the right kind of help, not having the right kind of resources. I think frequently, and maybe even in previous conversations, we've talked about like, life lived with more than enough versus not enough is a fundamentally different life experience. And the difference of living life without enough resources, right? Impoverished in some way, not enough money, not enough help, not enough people, not enough opportunity. What that means is no matter whatever you do, you can be the hardest working, smartest, most talented person. But if you just literally don't have the ability to do it the right way, it means that by default, every single one of your decisions is compromised. And if you have compromised decision upon compromised decision upon compromised decision, inevitably, those increments make things worse. Right. And that's where a lot of human suffering happens, not because people are lazy or they made a bad decision or whatever. It's just that you just literally didn't have the choice to do it right. And then people who have more than enough resources in the world, it's not an opportunity just to live like decadently. Really, practically, what it means when you have more than enough resources is the idea that you actually don't have to be perfect and things still might work out for you just fine. So, the buffers that you have with extra help, extra time, extra money allow you to make mistakes and say like, oops, and then you can just like fix it. And then you don't have to like really deal with the consequences, right? So that's another bigger conversation about understanding like what is this endpoint of depression, abnormal anxiety, why do people have these sort of maladaptive coping strategies like substance abuse, or whatever it may be. A lot of it has to do with the long-term cumulative consequences of just not being able to do things well, but not because of incompetency or laziness or whatever, like just the not being able to do things well leads to a lot of these sort of other bigger consequences. And again, the end result of a lot of these things would be like a depression or having an addiction or something like that.
Yeah. So I want to kind of summarize, because we've gone like micro and macro, that in our families, what we're talking about here is looking at our kids and partnering with them, coaching them, even if we want to criticize and judge them, like looking at what's underneath this behavior that they're doing. How can we help them meet their needs in a better way? How can we partner with them kind of generally?
Improving communication skills
and improving communication
from a family
skills.
kind of perspective.
Yeah. Like being in it together and having empathy for where they are, because their world is so different growing up than how the world was for us growing up. And then on a macro perspective, one of the themes that we've had with you over the years has been, if we come from a background of privilege or having more than enough, that we can be social actors and help out other people, that improves the lives of others and helps us all like create more of an environment that makes it less likely for people to struggle financially and educationally and racially and gender and all these different ways which people might be struggling, and kind of like it's the rising tide that lifts all boats.
Right.
Is that a good summary of kind of where we've been here?
I think so. I think just to connect one of those points, which is, part of the being less critical and less judgmental, is the larger insight that we all need to have, that at the end of the day, it's probably pretty rare that a person actually has something genuinely to criticize where like you brought this upon yourself. And therefore, like most of the time, there isn't a lot to judge or criticize for most people, because, many ways in which they've suffered or bring indirect suffering to other people is not something that a person has like chosen or brought upon themselves. So that's just an idea that I think if we really kind of embrace that and understand that as being accurate and factual, that in itself helps us be less judgmental. So that's one. And I think that the idea that most of the time as people struggle, right, that to get out is also not an individual endeavor, right? It's not like more effort bootstrapping your way, that in groups and societies, the way that people who don't have enough eventually get better requires that the people that have more than enough would share.
Yeah.
Right. And if we really think about it, it's literally not a crazy idea at all, right? It's like with the youngest of children, right? Like we instill this universal ethic, about doing it, right? It's the I don't know if I've used this example before. It's like you go to that birthday party with mixed age kids and there's a piñata, right? There's little toddlers and then there's like these like young adolescents. And what happens is eventually if the piñata bursts and all this candy drops, you're going to have these like, more older kids who are just faster and they know what the deal is and they've done this before. They're going to be like running around grabbing all the candy, and you got this like 2-year-old toddler around trying to grab it. And Okay, so in the end, okay, so the whole thing's over, and all these kids have completely different amounts of candy, and probably the advantaged children, the older ones and the ones that know what's going on, the ones that have done this before, have like all this candy, and then some other like really young kids, have some, and then there's some other kids that have like no idea what a piñata is, has no idea that this candy is for the taking, then the unwritten rules, because like they don't know. And in a most ideal situation, right, you start seeing the parents coaching, again, in an intuitive way with all their own children. Hey, why don't you share with so and so, right? You see those kids over, they didn't get any. You don't need all that, you don't need all that candy. And then ideally, right, and even in this sort of like small social context, we see like a pretty basic moral, ethical sort of, scenario play out, which is the ones that have like an excessive amount of candy that they would never eat, willfully, hopefully, sort of like, yeah, okay. And then they start handing out candy, starting with most of the time, they start off with the youngest kids, right? They're not like sharing with just their other same age kids. They're like, oh yeah, that kid had no chance because I took it all, and then they give it, right? So just to like prove that we're not talking about some like crazy radical political agenda, like this is at the core of a normal human ethic, that the way that we all do well is that some of us at different stages will end up with not enough, and some of us at different stages will have more than enough. And it is completely normal that everyone's needs, ideally in those circumstances, get met, because we help, we share, we notice, like that's a totally basic, fundamental human moral ethic, right? And so I think that that's, like, to normalize the idea of help, is it's strange. Sometimes we actually have to like go out of our ways. Like I've literally had to do a talk at a conference where I'm like, hey, help is normal, and for people not feel bad about it. But like the idea of we only thrive, we only have mental health, we only have well-being when we are helped on a regular basis through the rest of our lives, always. And on the flip side, the only way that most of us will actually ever find meaningfulness in our lives is that we also frequently throughout the course of our lives are the helpers as well. That's something that we have in abundance, that we have, that we're skilled at, that we have to offer, that we actually utilize that for somebody else's well-being. That, in positive psychology, that's that category of meaningfulness, which is sort of like the most fulfilling, highest level of contentment that a person can have. The only way of being quote unquote happy that leads to personal life satisfaction is the frequency in which we can identify things in our life where we've taken our resources and had impact on others, right? In positive psychology, they call that meaningfulness, right? Which is basic too. It's meaningful to do that. So that whole system, we're hardwired, to need help in order to like thrive. But we are also interestingly hardwired to get the most meaning out of life when we are the helper as well. So that system is baked in, it's baked in a natural way to humankind.
Nice.
That's fantastic. I like the analogy and the reminder. As we're wrapping up, I feel like we could talk, obviously, more. And but as we're wrapping up here, Joey, do you have any final words, or do you have a big ask for folks that are here?
I think, the conversations are happening right now, which is this idea. So this article that Cecilia is referring to, I think, I think in a very good way, this is the dialogue that's happening, that people are understanding that, our view of a hyper medical model, individualistic view of mental health, that the person is personally responsible for themselves, is inaccurate, it's broken, it's never going to work. So I think, as we kind of, over the next few years, I think hopefully we'll all just kind of be open to this idea that, community mental health, is sort of like the only way that we're really going to like make a difference for individuals' mental health. As a word of encouragement, oftentimes something that I've kind of come to terms with being a therapist for a real long time, is I'm, in a good way, I'm realizing that a lot of the conversations that we have around educating people about mental health or overcoming stigma or encouraging people to seek mental health, for the most part, that's only a problem with baby boomers and people in my generation who are in like this Gen X generation. We're the ones that have to like unlearn these negative stigmas. We're the ones that have to kind of like, accept, the idea that therapy is not only for like, somebody who's like really, really struggling, really needing it, or whatever, like seeing a psychiatrist, taking medication. Like we're the generation, my generation older are the ones that struggle with this. The encouragement is, I think millennials and younger, our kids, thankfully for them, this idea that their mental health is just their health is going to be a very intuitive, normal idea for them. So a lot of the learning, a lot of the growth, a lot of the changing regarding this overall conversation with mental health is the work of our generation and older, and I think it's a burden, but I think it's also, something that like, if we do better in this area, then our kids will do better, so I think that that's worthwhile. So that means that one of the other interventions that we can do is working on our own mental health, both directly and indirectly helps this larger sort of crisis we have overall regarding, the mental health of like society.
Yeah.
I like that
Working on
perspective.
it and talking about it.
Yeah.
Like, let's start having these conversations out loud in more public places.
Yeah. And those conversations are mostly between our peers.
Yeah.
If we have these conversations with our kids, they'll be like, duh. Like to them, again, it's a non-issue.
Yes.
So these are conversations we should be having with our peers, normalizing therapy. If you're in therapy, talking about that with your own friends, telling about getting help, like, again, these are the normalizing conversations. Again, it's within our generation that we have to teach each other. But like I said, our kids, they know.
They get it.
Yeah, they get it.
Normal part of their conversation. It's a good reminder. And I think that's good for us to be putting that into perspective and what we can do to shift that conversation. Joey, we've met with you multiple times. We've had multiple interviews with you. You have lots of great content available online. How can people find out more about you and all the content that you have available?
On my website, mentalhealthiness.com, I think there's actually a sub, like if you look at some of the entries there, I do actually go a little bit more extensively talking about the expressed emotion, especially, and some of the impact of environment. So I actually have a few articles in there talking about in much more detail some of the things we've been talking about today. So mentalhealthiness.com, got archive of old sort of articles in there. There's also an archive of different talks that you and I have done in other ways in which I've spoken on podcasts or whatever, which then also goes into some of the stuff that we've talked about in terms of like parenting, communication, things like that. So there's resources on there, mentalhealthiness.com.
Great. We'll put a link to it in the speaker notes. And Joey, once again, thank you for your time. Thank you for your insight. Thanks for all the thought that you put behind this. I just love these conversations and I get so much out of them. I know that other people do too. So thank you for spending that time with us and, talking to us again, and look forward to the next conversation.
Always enjoy these conversations. Thank you guys so much for having me again.
Thank you, Joey. Bye-bye.
Take care.
Bye.